Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and welcome to this July edition of Healthcare Quality and Risk Matters. My name is Gary Bierce, and I am joined by my two esteemed colleagues, Rob Santamore and Dr. Timothy Brown. We are delighted to be here this month. We've got a very, difficult topic to discuss this month that many folks in their organizations don't like to talk about because it's about their bosses. So we're talking about the C-suite and C-suite strategies, in particular, how quality needs to be at the core of that. And it's a great topic. I actually am excited about this topic today, guys. Before we dive into the incident of the month, any initial thoughts from you guys, Rob and Timothy?
I share the same sentiment. This has been my, frankly, largest struggle. There's in my last decade worth of work, working with the C-suite and getting their buy-in on how important it is to put there's quality at the core of decision-making.
I agree. I'm looking forward to this topic because I have a lot to share from the experience.
Pent up things to say.
I feel like of anybody, this topic is like there's the biggest for you, being both quality and administration at the same time. Like, yeah.
As a CEO, guys, I can tell you that I get frustrated by my peer group that often don't look to some very important things as levers in their organization that are right in front of them. But for some reason, it doesn't communicate to them that it's something they should lean into. You know, it's something they tolerate. And certainly in many healthcare organizations, if not most, they're looking at quality that way. They're looking at risk that way. It's something I have to do, not something I want to do, right? And hopefully after today, those who are attending, if you are watching with us today, welcome. Go ahead and put in a comment. Let us know where you're from. We'll give a hail out to you, a shout out sometime during our conversation today. Also, give us your questions. Keep bringing them forward. We'll try to weave them into our conversation. If not, we'll try to address them before we close out our podcast today. So our format, if this is the first time you're with us, we do an incident of the month. We look at something that's related to our topic that can shock us all. But the reason why we do this is because this is real. You know, we're not just talking about ideas. We're talking about things that are really affecting organizations out there. And, you know, we try to bring these incidents of the month so it makes it real for you as well. When we get done doing that, we've prepared a little bit of a teaching opportunity through our Minute Manners section where we can go through a little graphic we came up with and try to get everyone in the audience to visualize why quality needs to be at a core of a C-suite strategy. So, Rob, why don't we dive into the incident of the month? Let's see.
I will try to keep it brief because there is so much to talk about. This particular incident, the write-up is very extensive. It's on Genesis Healthcare. There's the Pennsylvania founded, there's long-term care organization that in their peak were around 500 nursing facilities. There's in 34 states. There's in 1,800 rehab facilities in 47 states. Currently, they have 175 facilities in 17 states. And the reason I share where they started and where they are now is because of all of the quality, risk, and compliance concerns that potentially led to that. There's a near bankruptcy in 2021 filing bankruptcy in 2025. There's in some of the potential causes, there's with legal fines such as false claims. There's against hospice services, other allegations. There's some civil fines. There's all things including like wrongful death suits, which is horrifying for those patients. And I'm so sorry.
Horrifying for the families. Wow.
Yeah,
Right, exactly.
absolutely. There's and to just name a few other fire safety violations, regulatory action. There's Legionella contamination. There's overall center closures because of dangerously high room temperatures, broken kitchen equipment, expired meds. There's inadequate infection control. And that is at the highest level I can keep it. So many other things that we could comment across all of these facilities that, to me, in my opinion, suggest they were not operating. There's with proactive risk, there's compliance, patient safety, there's
a complete risk and quality meltdown.
Absolutely.
That's what you're describing there.
Wow.
It does. I absolutely agree. I'm so sad for all of those families and all of those patients that experience that. And I hope that we can all take this information and these, like you said, Gary, and just do better.
Yeah. Well, this shows you that this is real. I mean, if you want to take the emotion out of it and just look at it from a business perspective, failing at quality, failing at risk is affecting your ability to attract your clientele. Your reputation starts to tank and nobody wants to use your facility. Now, if you add the regulatory element to this, and when the regulators are now getting involved and saying, you're terrible, we can't certify you, we can't keep you open, we have to fine you, you're now getting in dangerous area of criminal activity. I mean, there's a real problem here. It's good. We're going to talk about it later, but it's diving into how you look at risk, how you look at culture, how you look at your operations. And if you don't put quality in the center of all that,
right.
And some of this stuff just it feels easy, right? So Legionella, right? That's Legionella contamination has potentially nothing to do with the organization. It's the fact that they didn't have a plan. They didn't.
No plan.
The article suggests that they didn't do anything. If you found it, how did you manage it? What is your water treatment plan? What is your follow-up? What is your proactive audit and assessment to protect your patients from Legionella? Fire safety violations. That should be part of consistent rounding in assessment of both local code. There's state and federal standards. There's for fire safety and prevention. These are things that when you're managing your day, there's managing your processes and you're framing your thoughts around quality. You're not going to miss them. Or if you miss them today, you won't miss them tomorrow, which is the whole intent. Of keeping it at your core.
Well, Rob, to that point, I always say failure, in essence, is a team sport. So that you have to include everyone in that overall understanding.
Somebody write that down.
I know.
Everyone has a part in this overall failure. And when I look at any type of situation, especially something as extreme as this, I look at the culture of the organization. How are we engaging our overall employees in what it is they should be? How are we encouraging them to do the rounds and ensure they're doing the overall, what we would call simple checklists or check the box exercises that should be taken care of daily? I don't understand how like you said, you may be able to miss it one day, but to miss it multiple times to the point where you're getting fined millions of dollars, it's sheer neglect at that state. And then you have to look at the overall culture of the organization and say, why do our employees not care enough to speak up, or why is our leadership team not listening to our employees telling us what's going on the day-to-day roundings?
And Nicholas made a great comment there. It's not hard. Regulators want to see that you're at least trying.
That's
right. Exactly.
Put in an effort.
So true, Nick.
Yeah, Nick, that's a great comment. I mean, I remember seeing an interview with one of the top CEOs in America. We won't name the individual, okay? But it was an interview with this person, and they were talking about, well, what's the secret of success? And he says, well, I look for people who care.
Yeah.
You know, I want my organization to care, and it's not a big leap. You know, it's common sense.
I agree.
Absolutely.
Especially in healthcare, right, Rob? I mean, in
Yeah.
healthcare, that the word care is in is in your industry.
It's literally
For the right reasons. You have to want to do good, right?
Yeah.
I couldn't agree with this comment more. So often, and we tell our clients, right? They'll come to us and say, "There's, this is where we are." And we were just talking about, getting a Dropbox of like 1,300 pages of here's all of our stuff. We don't know what to do. Please come help us. And there's no reason to panic, because if you're coming to us for help, you're already starting something, you're already trying something, and then we can help you document that. And there's you as an organization taking those efforts to try and do the right thing, document that you're trying to do the right thing. You are actively attempting to improve. You are working your operations through the lens of quality. And if you can prove that, then you have that documented story to tell. You are likely to walk away with either minimal citation, or there's some opportunities for improvement that are supportive. Rather than the Connecticut Department of Public Health placing a facility on a termination track due to failed inspections, as I'm reading from this article.
Right. All right. Well, I'll tell you what, for the sake of time, let's transition over to, our little graphic for our audience's benefit, just to kind of talk through how we see the C-suite strategy should go. So when we think about quality is the thing that pulls in risk management, operations, and culture together to drive better patient outcomes. That's what it's doing. If you ignore it, these things start to fly apart.
Mm-hmm.
And, when they fly apart, you go into that down spiral. But if you have an attitude in the organization, a strategic direction in the organization emanating from the C-suite, that quality is going to be at the core of everything you do, everything will start to work out. It goes right back to Nick's comment. You're trying, you're caring, right? You're doing the right thing. I'm going to ask you, Rob, if you can kind of dive into each of these elements in a little bit of detail. For the sake of time, kind of go over it pretty quickly, but and then, but maybe we can use that to stimulate a little bit more deep dive conversation around this concept.
Yeah, there's just to dive a little deeper from what Gary was saying, quality at the core. There's organization has a culture, an operating mindset. And a proactive, intelligent risk process where you can continuously improve. Your decisions are data driven. They're based on something out in left field, or a thought or a feeling, right? Technology and innovation is used to implement, guide, improve with efficiency. And then also considering the cost impact. We have a great comment from Nicholas here about the balance of quality and cost. And we have a historical podcast on the cost of poor quality and how to really help manage the thought process around the financial impact of quality. Which I would love to dive into during this. For your operations, your operations needs to be done with the strategic alignment. There's allocating your resources. And budgeting and process management, again, focused around the quality outcomes that you're looking for to meet your strategic goal. There's your culture, which I'm so excited to talk about, because this is where the C-suite has such a massive impact. There's really defining that mission and vision, and is that mission and vision quality and focus. And your workplace environment, there's an employee experience. Do you make it so that there's a just culture? Do you make it so that there is line of sight into what is and is not happening well. There's and then risk. Are we being proactive? Are we appropriately with risk assessment? Are we identifying things as they occur? When crisis does happen, how are we managing that? And then on that, what risks are we mitigating as we go along, as we identify proactively and as we identify reactively? And I could go deeper and deeper. However, for the sake of time, that is the high level graphic. For those that are not able to see it on the line that are audio only. And
I like to react a little bit to Nicholas's comment there too, is that he's right. Often quality takes a back seat because it's perceived that there's no money for it. But we've said time and time again, if you have a top tier quality program, it's your source of funding.
It
doesn't take a lot. It really doesn't take a lot of understanding of financials to pull this in. Okay, we know that payers are going to be paying you at a better rate with higher quality.
Yeah.
We know you're going to avoid payers holding back revenue if you're using high quality. The cost, these additional incurred costs as a result of poor quality, as Genesis was going through the spiral, doesn't occur. You're freeing up capital. You're bringing in more revenue and freeing up capital. All these reserves and accruals that hospitals are making for quality start to come down. They don't need to do that anymore. So what they accrued for, they accrued for $15 million in a year and they only had $5 million. That's $10 million just freed up from the budget. Maybe now they can buy new orthopedic machines or what they need in the surgical arena, or bring in the new top tier surgeons in cardiology or whatever it may be to raise the level of their ability to offer care for that facility. And it was right there in front of them the whole time.
Couldn't agree more.
I want to say sometimes that I think organizations get caught in the forest and they can't really see the forest for the trees because they're like, okay, well, I want to improve. I want to put quality at the forefront. But think about Genesis. We're in this mess now. How do we work our way out of it? And honestly, the answer is quality.
Yeah,
it really is. Doing my job more efficiently, better each and every day. What can I do? What areas can I move to prevent for our patients so they're not falling or slipping? Or if it is fire prevention, what measures do we need to put in place? It's building out that overall plan so that you can have a step-by-step process to move forward. I mean, I think sometimes we just get frozen and it's like, well, we'll deal with the fires as they come. Well, that's a great strategy that never works. I mean, and also brings on more fires. So what we should be looking for is how do we prevent additional fires as we're putting out the fires that we have in front of us?
Yeah,
I love that. I love how you tied that into this graphic. It's not a linear thing, right? It's not. You are working forward and backward at the same time. There's backward, not in a reductive way, but backward in an assessment way. There's backward in a data gathering way, backward in a way that gives you information to continuously improve. And I love how you framed that around that. That makes a lot of sense. And then Mr. Bailey made another comment, and we couldn't agree with you more. You are very in line with our thought process. We appreciate this. In a strong quality, there's program does absolutely. There's ensure strong value-based purchasing outcomes. There's of course marketing. We talk about how there's marketing for recruitment, marketing for specialty services, retaining specialty services, how important that is. Leadership perception, of course. And absolutely the collaboration and punitive relationships with your regulators, and your ability to expand in your market. Is 100% regulated on whether.
If you're stuck in that punitive state with the regulators, you got to completely stop everything you're doing and correct that. Right? Get back on path. And apparently Genesis didn't do it.
No.
They
Uh,
took cost-cutting measures, shut down facilities. That was their plan for survival, rather than looking at their culture and looking at their quality programs and making a strategic shift.
I I couldn't agree more. And I feel like the C-suite's responsibility is to take this graphic. There's wake up every day. And try to frame all of their processes, all of their communication, all of their expectations for their team, for their facility. There's around this. Right when they're making strategic decisions throughout their day or allocating resource, are they doing it? There's area of highest need and quality and highest risk. There's putting there's budget in place to support the right spaces. Are they being proactive with their risk management? Instead of just responding to incidences after they happen, that's not risk management. For everybody on the call, we will support you when you tell your C-suite. Incident management is not, there's real risk management. That is just a part of the response after something identified. Anyway, we can dive into that in a whole nother podcast. And Timothy, I would love your thoughts on the culture.
Yeah, I want to jump on this too. I think the goal, if we had to tell the CEOs or our C-suite one thing that they get, because I think they get a lot of charts, they get a lot of executive summaries, they see the information, and then no action happens. The goal really is to create that unified approach to quality. We see 3 different areas. Many times these areas in your organization may be split out between 6 to 8 different departments. But the problem is none of these departments talk to each other. There's no communication across departments, and then that causes those disenfranchised conversations or issues to happen. And then all of a sudden there's a major lawsuit and no one knows how it happened. There needs to be communication across departments, with nursing leaders, with your administrative leaders, with operations. Everyone needs to know their part and how their part functions towards the overall goal of the organization. If you don't know that, start there is what I'll say. How does my individual department function well? And then how are we the gear that continues to rotate for the organization to move forward? And as you understand those overall intricate details, it helps you to see, well, maybe we need to do better processes here so that facilities management can have their overall the things that they need. Maybe nursing needs additional understanding of slips and falls, that we can tell facilities management to be on watch out for these particular halls and things of that nature. But it helps us to kind of communicate across the board, and it just begins to make sense of how our work affects those around us and the employees around us as well. I mean, ultimately, that's going to spill over to the care of the patients that you have, the overall experience for your overall employees, and it'll get back to the C-suite of what actually needs to be changed, so they're not scrambling and fumbling, trying to figure out how to move this train forward.
I love all of that. I couldn't agree more, because this has been my biggest struggle since I've started. In healthcare quality, risk, and compliance there's working with the C-suite when there's focused on a handful of metrics that they believe decide whether or not their organization is financially healthy, without a true understanding of how those metrics grow or fall.
Right.
And they grow and they fall based on the culture that the C-suite sets. And if they don't set a culture that is a just culture that allows for risk management, if they don't set a culture that there's aligning themselves with quality, strategically, their operations are going to fall. And this whole circle just completely falls apart. Mr. Bailey added another comment, and I appreciate this. There's predictive risk management that can support C-suite conversations. And I absolutely agree. And a part of that is setting that culture up so that people feel good about reporting. They want it to be better. And they want to make sound, intelligent decisions that are fed by good information coming from the patient experience. Which also, to a previous point, value-based purchasing, patient experience, your HCAP scores, absolutely going to impact how much money you get. And so all of this does tie together. And an extraordinarily cyclic way. There's no individual point that just floats out in the middle of nowhere. Everything is impacted by something else.
To Nick's point that he spoke of predictive risk management, that brings me to another podcast that we have where we talked about bringing quality to the table. Having your quality leader at the table allows you to be able to tell that story because they have an understanding of all three of these overall operations and how they function to make the organization whole and well. So they can bring the predictive analysis, they can bring the predictive management to ensure that the C-suite understands, well, if we make this change, if we tweak this overall, this is how it's going to affect the overall organization, not only now, but 2, 3, 5 years down the road as well.
Yep.
Totally agree.
How are we doing on questions, Rob? You have any questions from the audience?
So it looks like we've addressed the questions as we went along. Mr. Bailey, sorry to highlight you so much. We just really appreciate there's engagement and how you have a very similar thought process around there's this work, the need to put quality at the core. So anybody else has any questions, please feel free to drop them in. If you don't feel like we've answered your question, feel free to drop it again, and you can always reach out to us after the podcast. There's to ask any questions or gather any of our materials. There's to share with your C-suite to help them change their culture and put quality at the core.
So why don't I try to bring it home, guys? Let's bring it home. And, let's think about what we're saying here and what the graphic is trying to describe. If your organization wants to reach peak performance, if your organization is struggling and wants to turn things around on a performance level, so we're talking about, yes, the P&L. We're talking about, yes, how the regulators view you. You have to shift your strategy towards quality being part of the core of how you run and strategically plan for your business. So where do I begin? Okay. If I'm a CEO or I'm in a C-suite, begins with culture. You have to make a conscious decision that this is the direction you're going in, and you communicate that in mission statements, value statements, policy statements, lay out specific procedures that everyone involved in the organization would need to adhere to, and build that culture through positive feedback for those who are taking initiative in this area. You want everyone reporting incidents, regardless of what it is. No judgment. It's a just environment, a just culture, as Rob described it. Then think of risk management proactively, not just to put Band-Aids on problems. Get ahead of it. Get ahead of what's required of you. Get ahead of the risks that exist in your organization. Take appropriate action, but think about preventative action so that as you cycle through this, your actual significant incidents begin to shrink more and more and more, and becomes more of a fun environment for your staff, that they're doing a great job and their patients are leaving better than when they found them, far better than when they found them.
Absolutely.
Amazing.
Right?
Yeah.
And lastly, weave it into how you actually administer your operations. Be involved. Make sure that quality is part of your strategy, how you think of resource allocation, budgeting, other processes in your organization. If you do these things, I promise you that you're going to start seeing a continuous improvement in your organization. Data is going to be percolating to the top. That's going to give you better information for decision making. And you're going to now look at what technology you need and how you need to move forward with a completely different lens. You're going to realize you need something that's integrated, that's advanced, that's more keeping in step with how you're running your organization. And you wait and see the financial impacts you're going to see out of this. You're going to be amazed at what the result is. So we implore you from the Aperitisoft healthcare team, think about quality as being a strategic decision. It's not a compliance decision. It's a strategic one. So we'll give Nicholas the final word here with his comment there. So what did Nick have to say?
Do you feel C-suites are ready for the shift in oversight, which hopes to foster quality and value and care, but holding organizations more accountable to that high reliability model? And we actually did a podcast on HROs. There's, you want to take that one, or do you want me to?
Yeah, I'll take 20 seconds and I'll give it to you. I'm going to say, cool. I'm not going to put the pressure on C-suites. I will say this. If the C-suite has a quality leader that's a voice for the organization, absolutely yes. If your C-suite does not have a quality voice, I think you need to start there. You need someone that understands quality at its finest and granular level. And that's in the data, that's having the information available. If your organization does not have a quality person and or a quality system that tracks this information, you have to start there, because you cannot provide a futuristic view of the organization without understanding what issues are currently going on, whether that's doing a risk assessment or whether that's doing a full-on overview and assessment of the entire organization to understand what your greatest risks are. So I would say I wouldn't put it all on the C-suite. You have to look internally to say, what measures have we put in place to ensure that we can support this overall change and shift for our C-suite, because they're going to do with what we tell them to do if they have the right data.
I really like that smarter step approach. Yes, as healthcare, we want all of our healthcare facilities to be HROs, right? High reliability organizations are extremely important for the outcomes of our patients and for the care that our country is able to provide our people. But not everybody is ready for HRO. So taking the initial steps, adjusting your culture so that you do have quality at the core of your decision making, strategically placing people to, Dr. Brown's point, in the right positions to help move that needle so that you can get there. I think everybody is, or at least should be, ready to at least start there. At least start with your culture shift. At least start with your mindset. There's of quality. There's in focus at the core of all of your strategic planning. And you can then become an HRO if that's your journey.
And if you need resources about this, we have a great pyramid we developed that talks about the pathway to getting to an HRO and what those stepping stones, those milestones would be to get there. Please reach out at insights at aperisofthealthcare.aperisoft.hc.com, and we'll get that into your hands right away. This wraps up our live session of the podcast for this month. Next month, near the end of August, it'll be on a Wednesday again, near the end of August. We're going to be talking about Leapfrog, looking at Leapfrog results and how Leapfrog can play a role in how you gauge your organization's quality and view them versus your peers. And we have a good show planned for you. I don't know all the details yet, Rob, but I know we've been discussing this for some time. Right after this show, we're going to do a live after show. It's going to be found on YouTube. Any details we can give them, Timothy, about how they can find us there for the after show?
Actually, I put the details in the chat. So click the link in the chat that says join us for the after show on YouTube, and we'll see you guys over there.
In the after show, we'll talk a little bit more about our technology and how it can help you with all this kind of thing that we're talking about today. Give us a like, give us comments out there. Please follow us on LinkedIn, Instagram, and YouTube, if you wouldn't mind. We really appreciate those who participated today. Thank you, Nicholas Bailey. You were a great panelist today. You contributed quite a bit. We appreciate that. And any other final words or salutations, guys?
No, I'm excited about the after show. I have a lot to say.
Absolutely.
Okay, very good. We hope to see you there at the after show. Take care, everybody. See you next month.